Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A successful real estate agent brought to the clinic after being arrested for harassing and stalking his ex-wife denies any other symptoms or problems except anger about being arrested. The ex-wife reports to the police. He is fine except for this irrational belief that we will remarry. When collaborating with a healthcare provider about a plan of care, which of the following will be most effective for the client at this time? 1. A prescription for olanzapine 10 milligrams daily. 2. A joint session with the client and his ex-wife. 3. A prescription for fluoxetine 20 milligrams every morning. 4. Referral to an outpatient therapist. The correct answer is 4. Follow-up counseling is appropriate because of the client's anger and inappropriate behaviors. The goal is to help the client deal with the end of his marriage. A joint session might have been useful before the divorce and arrest, but not after. The client is exhibiting no signs or symptoms of schizophrenia or psychosis, so olanzapine is not indicated. The client is not exhibiting signs of depression, so fluoxetine is not indicated. When developing a community-based service program for clients with chronic mental illnesses, which of the following is the least important? 1. Partial programs. 2. Psychiatric home care. 3. Residential services. 4. Long-term hospitals. The correct answer is 4. For a community-based program, the need for long-term hospitalization is least needed if the other services, such as partial programs, psychiatric home care, and residential services, are available and accessible. A newly admitted client with an acute exacerbation of psychotic symptoms of chronic undifferentiated schizophrenia is having trouble deciding whether to live in a group home or a supervised apartment. When caring for this client, which of the following activities is most appropriate for the nurse to ask the client to do initially? 1. List the pros and cons of each housing option. 2. Choose between apple and orange juice for breakfast. 3. Identify why the client cannot live in an unsupervised apartment. 4. Decide which staff member the client would like to have today. The correct answer is 2. The client is in an acute psychotic state and cannot process complex decisions or explain complex situations. Therefore, the nurse would focus on decision making involving simple choices, listing the pros and cons of each housing option, and identifying why the client cannot live in an unsupervised apartment involve complex decision-making skills. Deciding which staff member to have today is a difficult and threatening decision for a client who is psychotic. As the nurse enters a room of a newly admitted prima gravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. The nurse should do which in order of priority from first to last? 1. Call for immediate assistance. 2. Turn the client to her side. 3. Assess for ruptured membranes. 4. Maintain airway. The correct order is 1, 3, 2, and 4. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. Next, the nurse should turn the client to her side and then maintain the airway by keeping the neck hyperextended. When the seizure is over, the nurse should assess the client for ruptured membranes and the fetal status. A client in sickle cell crisis has been hospitalized during her pregnancy. After giving discharge instructions, the nurse determines the client needs further teaching when she states which of the following? 1. I will need more frequent appointments during the remainder of the pregnancy. 2. Signs of any type of infection must be reported immediately. 3. At the earliest signs of crisis, I need to seek treatment. 4. I have this disease because I don't eat enough food with iron. The correct answer is 4. Sickle cell disease is an autosomal recessive disorder requiring both parents to have a sickle cell trait to pass the disease to a child. Deoxygenated hemoglobin cells assume a sickle shape and obstruct tissues. Tissue obstruction causes hypoxia to the area and results in pain, called sickle cell crisis. This type of anemia is an inherited disorder. It is not caused by lack of iron in the diet. Self-monitoring for any type of infections or sickle cell crisis An increased frequency of antenatal care visits are part of the teaching plan of care. A multigravida client thought to be at 14 weeks gestation reports that she is experiencing such severe morning sickness that she has not been able to keep anything down for a week. The nurse should assess for signs and symptoms of which of the following: 1. Hypercalcemia. 2. Hypobilirubinemia. 3. Hypokalemia. 4. Hyperglycemia. The correct answer is 3. Gastrointestinal secretion losses from excessive vomiting, diarrhea, and excessive perspiration can result in hypokalemia, hyponatremia, decreased chloride levels, metabolic alkalosis, and eventual acidosis if precautionary measures are not taken. Ketones may be present in the urine. Dehydration can lead to poor maternal and fetal outcomes. Persistent vomiting can lead to hypocalcemia, not hypercalcemia. Hyperbilirubinemia, not hypobilirubinemia, is typical in clients with hyperemesis. Persistent vomiting may affect liver function and subsequently the excretion of bilirubin from the body. Hypoglycemia, not hyperglycemia, may occur as a result of decreased intake of food and fluids, decreased metabolism of nutrients, and excessive vomiting. After doing well for a period of time, a child with leukemia develops an overwhelming infection. The child's death is imminent. Which of the following statements offers the nurse the best guide in making plans to assist the parents in dealing with their child's imminent death? 1. Knowing that the prognosis is poor helps prepare relatives for the death of children. 2. Relatives are especially grieved when a child does well at first but then declines rapidly. 3. Trust in healthcare personnel is most often destroyed by a death that is considered untimely. 4. It is more difficult for relatives to accept the death of an older child than that of a toddler. The correct answer is 2. It has been found that parents are more grieved when optimism is followed by defeat. The nurse should recognize this when planning various ways to help the parents of a dying child. It is not necessarily true that knowing about a poor prognosis for years helps prepare parents for a child's death. Death is still a shock when it occurs. Trust in healthcare personnel is not necessarily destroyed when a death is untimely if the family views the personnel as having done all that was possible. It is not more difficult for parents to accept the death of an older child than that of a younger child. When assessing a client with chest trauma, the nurse notes that the client is taking small breaths at first, then bigger breaths, then a couple of small breaths, then 10 to 20 seconds of no breaths. The nurse should chart the breathing pattern as 1. Cheyne-Stokes respiration. 2. Hyperventilation. 3. Obstructive sleep apnea. 4. Beale's respiration. The correct answer is 1. Cheyne-Stokes respiration is defined as a regular cycle that starts with normal breaths, which increase and then decrease followed by a period of apnea. It can be related to heart failure or a dysfunction of the respiratory center of the brain. Hyperventilation is the increased rate and depth of respirations. Obstructive sleep apnea is recurring episodes of upper airway obstruction and reduced ventilation. Beale's respiration, also known as cluster breathing, is periods of normal respirations followed by varying periods of apnea. A young adult is admitted to the emergency department after an automobile accident. The client has severe pain in the right chest where there was an impact on the steering wheel. Which is the primary client goal at this time? 1. Reduce the client's anxiety. 2. Maintain adequate oxygenation. 3. Decrease chest pain. 4. Maintain adequate circulating volume. The correct answer is 2. Blunt chest trauma may lead to respiratory failure, and maintenance of adequate oxygenation is a priority for the client. Decreasing the client's anxiety is related to maintaining effective respirations and oxygenation. Although pain is distressing to the client and can increase anxiety and decrease respiratory effectiveness, pain control is secondary to maintaining oxygenation. Maintaining adequate circulatory volume is also secondary to maintaining adequate oxygenation. When teaching a client to deep breathe effectively after a lobectomy, the nurse should instruct the client to do which of the following? 1. Contract the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds, then exhale. 2. Contract the abdominal muscles. Take a deep breath through the mouth and exhale slowly as if trying to blow out a candle. 3. Relax the abdominal muscles. Take a slow, deep breath through the nose and hold it for 3 to 5 seconds. 4. Relax the abdominal muscles. Take a deep breath through the mouth and exhale slowly over 10 seconds. The correct answer is 1. The recommended procedure for teaching clients postoperatively to deep breathe includes contracting the abdominal muscles and taking a slow, deep breath through the nose. This breath is held 3 to 5 seconds, which facilitates alveolar ventilation by improving the inspiratory phase of ventilation. Exhaling slowly as if trying to blow out a candle is a technique used in pursed lip breathing to facilitate exhalation in clients with chronic obstructive pulmonary disease. It is recommended that the abdominal muscles be contracted, not relaxed, to promote deep breathing. The client should breathe through the nose.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.